in January, it's Cervical Cancer Awareness Month. And who better to call than our friends from Roswell Park? And joining us now, we have Dr.
Emmy Zeros.
Yes, thank you.
Good morning.
I didn't want to say it wrong, doctor. Thank you for joining us. Okay, so let's get right into it. Cervical health. It's very, very, very important. How soon should we be talking about this?
So this is a hard question because many of us would not like to talk to our daughters and sons about cervical cancer at early age. However, we recommend that you talk to your pediatrician and start these discussions early on, around age 11 to 12, because that's when we start giving HPV vaccination for our children.
And when you're speaking about HPV, human papillomavirus, correct? So this is something, again, a vaccine for a virus, to keep the virus at bay, because it's the virus itself that leads to cervical cancer,
That's
correct?
correct, yes.
Can you explain that for folks out there?
Yes.
Yeah.
So HPV is a very common virus. It's found literally everywhere, and everyone who had exposure to sexual contact will get exposed at some point in our lives. And it is typically spread by skin contact and mostly genital contact. So it is very prevalent, and most of us will get exposed at least once or to one strain in our lives.
Yeah.
And then over time, it can lead to changes in cervical tissue, but it can also lead to vulvar cancer, vaginal cancer, rectal cancer, and even cancer in the mouth. So there are multiple other health implications to it. But many of these cancers are preventable if someone shows up for early screening.
And I think I was just going to say that is the beauty of this right now. This conversation is that we're talking prevention. Every time we have our friends from Roswell Park Comprehensive Cancer Center here, the main conversation is about prevention, because there's so much hope in that.
Yep. And people may ask, why so young? And you brought up a really, really, really good point on why you get the vaccine so young. Please tell everyone.
So the main reason why we vaccinate so early, because we want to prevent the first sexual intercourse and exposure. So we would like to train the immune system early on when there is no possible exposure. But also it's easier to vaccinate younger children. They just mount a more robust immune response and a stronger immune defense. So unfortunately, as we age, our immune system declines. And this is even visible after age 26. So the vaccination is recommended between age 11 up until 26, but currently is available up until age 45. So if someone didn't receive it up until age 26, you can get it until age 45, both men and women. But we just don't have such a great data on the efficacy after age 26.
Oh, okay. So the research is still ongoing, as it is in most things.
Yes.
So here's the thing. If it's not required, like you see, well, a lot of vaccines aren't 100% required, but there is a certain amount of vaccines that are required for children up until a certain point. But this is one you should definitely talk to the doctors about, correct?
Yes.
Because it is at an age where it's not in the regular course of vaccinations for children, correct?
Yeah, so it's not mandatory. So it's more like an opt-in vaccination. You can choose to give it to your sons and daughters if you would like to do that. Most pediatricians are highly encouraging parents to consider giving the vaccine. Again, this is so effective of preventing cervical cancer and precancer. We know that there is an 88% reduction of developing genital warts, precancer lesions, and cervical cancer. That is one of the best prevention strategy we have currently in healthcare to prevent cancer formation.
We also know that Roswell is very good at addressing disparities in our community. There is deep disparities in the Hispanic and the African American community. Can you speak to that?
Yeah. I mean, we definitely know that cervical cancer, precancers disproportionately affect more Hispanic women. And unfortunately, Black women have worse outcomes when they get cervical cancer. I think, many of this comes down to not having proper access for screening, not really doing a great job with our daughters and sons, educating them early on about the prevention strategies. And of course, sometimes when people show up for care, we try to do our best to deliver the same amount of care, but Sometimes there's a mistrust with the medical community. So I think we do have to spend a lot of time educating our patients to make sure that they understand the importance of regular screening. So we're not just talking about vaccination, but also annual pap smears and HPV testing that is available for all women, which again is another very effective strategy for cervical cancer prevention.
All right, so we're going to break it down to nuts and bolts right now. People don't like to hear this, but how deadly is cervical cancer? What should people know about this cancer and how severe it can be so that prevention seems like a no-brainer?
Yeah. So this is one of the most common cancers worldwide. It's about the 4th leading cause for women's cancer death worldwide. Again, in the United States, because of the better and stronger healthcare system, women go for screening more frequently than in some low-income countries. But we still have about 14,000 new cases annually, and about 4,000 women die from cervical cancer in the United States. And all of these are completely preventable, or almost completely preventable. So I think the message here is that if people get the vaccines early on, the risk of developing precancer lesions is extremely low. And if you didn't get the vaccines or immunocompromised, going for regular screening will definitely catch the cancer cells early on, so you will prevent the bigger cervical cancer.
Thank you so much for all that
Our
information.
pleasure.
And before we go, quickly, I just wanted to ask, once you are immunized at this young age, are there boosters that are required throughout life?
No. So once you receive your vaccine courses, we don't boost people any longer. So sometimes people get naturally boosted by exposure in life, but there's no further vaccinations recommended.
Great information.
Yeah,
Thank you
very
so
good.
much, Dr. Zeros. We
Thank you. Our
appreciate
pleasure.
your time. And if you would like to share this information with your family, all the helpful information, of course, is at roswellpark.org, and you can find very specific information on the vaccine, and we'll make sure to post that on our socials as well.